Chromogranin A and NET Biomarkers, what your blood tests really mean. Hello, this evidence-based content is prepared by Saboor, fellowship-trained consultant surgeon, and if you or someone you care about has been diagnosed with a neuroendocrine tumor or NET, and you're trying to understand what all those blood test results actually mean, you're in the right place. I know when you see terms like chromogranin A or 5-HIAA on your lab reports, it can feel overwhelming. But today, we're going to decode these tumor markers in plain language. Before we dive into the specific tests, let's quickly establish what we're dealing with. Biomarkers are essentially substances your tumor produces that we can measure in your blood or urine. Think of them as chemical fingerprints that help us track what's happening inside your body. For neuroendocrine tumors, we use two types of markers: general markers that most NETs produce, like chromogranin A, and specific markers that certain tumor types release, like serotonin and carcinoid syndrome. Chromogranin A, often abbreviated as CGA, is the most important general biomarker for most neuroendocrine tumors. This is a polypeptide secreted by neuroendocrine cells throughout your body, and research demonstrates it has a sensitivity and specificity somewhere between 60 and 90% for detecting NETs. Now, what does this look like in real terms? If you have an untreated small intestinal NET, your CGA level typically correlates with how much tumor is present. The single most common cause of falsely elevated CGA levels is something many people take every day: proton pump inhibitors. Those are medications like omeprazole or lansoprazole for heartburn and reflux. These PPIs cause a condition called hypergastrinemia, which dramatically elevates CGA levels even when there's no tumor present. Where possible, your doctor should stop PPIs and wait at least 3 half-lives before measuring CGA to get an accurate reading. There's another technical issue you should know about. Different laboratory assays measure CGA differently, and the results cannot be directly compared. That's about as frustrating as using different measuring tapes that give different lengths for the same object. This is why serial measurements should always be performed using the same assay at the same laboratory. If your testing lab changes, you need a new baseline measurement. Urinary 5-hydroxyindoleacetic acid is the breakdown product of serotonin and is particularly useful for diagnosing and following small intestinal NETs with carcinoid syndrome. The carcinoid syndrome includes symptoms like flushing, diarrhea, and wheezing caused by excess serotonin release. The overall sensitivity and specificity of U5-HIAA in the presence of carcinoid syndrome are approximately 70 and 90% respectively. Midgut NETs, those from the small intestine, are most likely to produce carcinoid syndrome with elevated U5-HIAA. This test requires collecting all your urine over a precise 24-hour period. You can't just collect one sample. Every drop of urine passed during those 24 hours must go into the collection container. The urine should be collected in plastic containers with acid added to ensure stability and stored in a refrigerator until analysis. But here's something that might surprise you. Certain foods and medications can dramatically affect your results. You need to avoid serotonin-rich foods for at least 24 hours before and during collection. That means no bananas, pineapples, kiwis, walnuts, pecans, avocados, or certain medications. Written instructions should be provided by your medical team detailing all these precautions. Because individual variation can be high, 2 consecutive 24-hour collections, with the mean value used for diagnoses, gives the most reliable result. Serum pancreatic polypeptide, or PP, can be useful, especially for NETs included in multiple endocrine neoplasia type 1 syndrome. However, the percentage of patients with elevated PP concentration is much lower than those with elevated chromogranin A. Think of PP as a more specialized marker rather than a first-line test. Your doctor might order this if there's suspicion of MEN1 syndrome or specific pancreatic NET subtypes. Now let's talk about what might represent the future of NET monitoring. The NETest is a blood-based multi-analyte biomarker test, where the expression profile of selected gene transcripts characteristic for neuroendocrine tumors is analyzed. This is sometimes called a liquid biopsy because we're analyzing tumor-related genetic material circulating in your blood. Preliminary data indicate the NETest has high sensitivity and specificity for NETs, and may be superior to chromogranin A. However, and this is important, its precise role must be validated in prospective randomized controlled trials, which are currently ongoing. It's not specific for any particular NET type, and its clinical practical usefulness is therefore being carefully evaluated. This technology represents hope for better monitoring, but we're not quite ready to replace our established markers just yet. If you're wondering whether you should ask for NETest, discuss this with your NET specialist. So here's your bottom line. Let's talk about the 3 categories of action you can take based on understanding these biomarkers. First, create a comprehensive medication list, including all over-the-counter medications, especially PPIs for heartburn. Second, if you're scheduled for a 5-HIAA urine collection, request written dietary and medication restrictions from your medical team. Set specific reminders on your phone for the exact 24-hour collection period. Third, start a simple biomarker tracking log. Ask these specific questions at your next appointment. Which biomarkers are most reliable for my specific NET type? The answer varies. Small intestinal NETs with carcinoid syndrome rely heavily on 5-HIAA, while non-functioning pancreatic NETs may depend more on chromogranin A. Should I stop my PPI before the next chromogranin A test? And if so, for how long? Your doctor can calculate the appropriate washout period. Are my biomarker trends more important than absolute values? Generally, yes. If you develop new symptoms suggesting carcinoid crisis, severe flushing, rapid heartbeat, sudden blood pressure changes, severe diarrhea, or breathing difficulty, seek immediate emergency care. This is especially critical if you're undergoing surgery, anesthesia, or experiencing physical stress. If you have carcinoid syndrome, annual measurement of NT-proBNP, a marker for carcinoid heart disease, should be performed to detect development of heart valve problems early. Elevated NT-proBNP requires echocardiography evaluation. For functioning tumors with specific hormonal secretion, biomarker monitoring typically occurs every 3 to 12 months, depending on symptoms and tumor aggressiveness. For stable, slow-growing grade 1 and grade 2 tumors, follow-up imaging and biomarkers are usually between 6 and 12 months, though some patients may require earlier evaluation. Your medical team individualizes this schedule based on your tumor characteristics, treatment, and symptom control. Let me quickly recap. Biomarkers like chromogranin A and 5-HIAA are powerful tools for monitoring your neuroendocrine tumor, but they have important limitations, especially when you're taking PPIs or have other medical conditions. Your next step: review your current medications and prepare specific questions about your biomarker results for your NET specialist. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. All links are available in the description below. Thank you for watching.